Welcome to the training, Self-Care, and Burnout Prevention for Crisis Response Workers. My name is Jennifer Hodson, and I am with Health Management Associates, or HMA. HMA is a leading independent national research and consulting firm that focuses on improving the administration and delivery of public health care and social services programs. HMA is supporting the Mississippi Department of Mental Health in its efforts to enhance the state's crisis response system by providing monthly online crisis response trainings and monthly crisis provider convenings. We are really glad that you're here with us today and hope you enjoy this training. There will be three primary learning objectives that we're going to cover today. The first is we'll define burnout, compassion fatigue, and secondary traumatic stress in crisis response work. Then we'll identify some evidence-based self-care strategies and resilience building practices that reduce burnout and compassion fatigue in high-stress environments, such as crisis response services. The last learning objective, we will develop a personalized, sustainable self-care plan that incorporates trauma-informed principles and organizational supports to promote long-term well-being and effectiveness in crisis response roles. Before we begin, let's not forget that what you do matters. Not everybody can be there for others during their most vulnerable time. This training is about supporting you in your role. Thank you. So for our first objective, we're going to talk about the impact of acute and prolonged stress in crisis response work. Crisis work and crisis workers experience very unique stressors as to some of their other professional colleagues who may have crises in their work, but that's not exclusively what they're doing. So let's unpack what that means. So for the next several slides, we're going to look at the unique stressors in crisis response work. We're going to talk about several topics that you may experience in your work, and so you may find very relatable and some that you haven't yet experienced, but would be very good to know about. So one of the unique stressors that crisis responders oftentimes experience is exposure to high stakes acute crises. So oftentimes you're dealing with life-threatening situations, such as clients who are experiencing suicidality, violent or psychotic episodes, overdose crises, to name a few. The decisions that you make often have to be made very, very quickly and without a lot of information, which really increases the pressure that you experience in your job. And sometimes that promotes a risk of moral distress, knowing that you would like to be able to do more or have more time, but don't. So that can create that high stakes, unique stressor. The next one is repeated exposure to trauma. So, working with people that experience a lot of reaction and response to trauma and hearing their stories and witnessing the levity in which many people are trying to survive in can result in secondary or vicarious trauma. So, the more that we hear stories of abuse, neglect, violence, or people managing with severe mental illness or loving others with severe mental illness, it could really take its toll. And a lot of this stress can also be due to continual emotional engagement. So, as a crisis response worker, you are your own instrument. You're walking in that space with your empathy, with your expertise and your knowledge, and what resources you have to offer. And that over time, that repeated exposure can also create unique stress. A lot of the work you do is unpredictable and your workloads are variable. So each day can be very, very different. The crisis calls are unscheduled, they're urgent. Sometimes you can have inconsistent hours, interrupted sleep, and some shift work that really can mess with your circadian rhythm. And so that in and itself is another unique stressor. In addition, handling variety of cases with multiple intense demands and in one shift that can also result in cumulative stress. You also face unique safety and personal risk concerns. So, physical danger from clients in crises who may be evidencing aggression, self-harm, or even have weapons and threatening. You may navigate unsafe environments in certain home visits or high-risk neighborhoods. So, all of those are very unique to your job. You also experience what we call emotional labor and role demands, where holding empathy for long periods of time, maintaining composure, practicing professionalism in midst of very chaotic situations can be very demanding. Managing the emotional needs of others while suppressing your own can also be very emotionally laborious and demanding. Another unique stressor is very high accountability and legal ethical pressures. So the decisions that you make in your job can have life or death consequences, may result in involuntary hospitalizations or safety interventions where you have to think quick on your feet and utilize all that great training that you've received to be able to do your job. You may face complex ethical dilemmas like confidentiality and duty to warn that can also increase moral distress. There may be organizational and systemic stressors, such as having not enough resources, staff, time, community support services, documentation and administrative burdens on top of your direct care responsibilities, and then sometimes a lack of organizational support, supervision, debriefing opportunities. And then the last unique set of stressors are cultural and community. A lot of our work is going to be working with populations who are facing systemic inequities, such as poverty, racism, homelessness, and these can amplify your feelings of helplessness. Responders may witness repeated cycles of trauma or systemic barriers to care, going back to the same communities and the same spaces and not having different answers or resources. Another is role ambiguity and interprofessional challenges. So, juggling multiple roles and needing to navigate multiple team members. And how do you manage? Who takes the lead? When do you share the lead? When do you step back? So, this can be between the therapist, the interventionist, the peer support specialist, the safety officer, mediators, all simultaneously needing to kind of navigate together. And then coordinating with police, EMS, hospitals, social services. This can lead to conflicting priorities and stress if we're not communicating, working well together, which is why this training series that the state is putting together is so important to that we bring all of our crisis responders together so we can work better together and reduce some of these unique stressors. And then the last is personal life impact. Having exposure to very intense crises can affect your personal life, can cause disruptions in your sleep as you're rethinking elements of your day. You can have these breakthrough intrusive thoughts in the middle of dinner or trying to focus on a movie or being with your family. You can also experience what we call emotional numbing, where it's very hard to connect in certain conversations and situations in your personal life because of the heaviness of what you're carrying in your professional. And this can lead to risk of social withdrawal, burnout, or relationship strain. So this isn't where we end, though. This is where we begin because the training today is designed to help you figure out how to prevent getting into a space where you cannot recover from that. So the big picture, and we want to look at big picture consequences if this goes unchecked, right? If stress or trauma related disorders, depression, anxiety, turnover, physical health declines in your responders is not checked and self-care strategies are not put in place at the individual and systemic levels. Then we see reduced engagement. So your staff will engage less with each other, with the people they're trying to take care of. There may be more opportunities for errors in risk assessment, and then ultimately lower quality care. So taking care of your crisis worker and yourself is the most important instrument we want to maintain. There's several things that we want to watch out for among crisis responders, and we're going to touch each of these boxes in the next couple of slides. The first one is burnout. Second one is compassion fatigue, and then the third one is secondary traumatic stress. There will be slight overlaps between them, but they are very distinct. So let's first start with burnout. So, by definition, burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed, characterized by emotional exhaustion, depersonalization, which is we have increased mental distance from our job, or feelings of negativism or cynicism as related to our job. So we become very cynical in the way that we think about our work, not thinking what we do matters, or that anybody really cares or sees it as important. And then reduced personal accomplishment, not feeling as much gratification that we're doing anything to be helpful to those that we're trying to serve. And some signs of this are chronic fatigue, low energy, even after you've had time off of work, plenty of sleep. Um, so we notice that people are not able to recover even after rest. They experience what's called emotional blunting, so kind of flat affect, not really responding to situations where they would normally feel joy or anger or fear. Um, and we oftentimes see more irritability because that's an emotion that a lot of people will bring forward, but behind that irritability is where pain and shame and sadness and worry live. So these are signs that burnout is a part of the organizational structure and we need to manage that. That cynicism, negativity, detachment from work, reduced sense of efficacy or productivity, avoidance of certain types of cases. So people start to restrict the types of places they want to go, people they would like to see or serve, types of cases. They might get what we call kind of heart drop or that feeling in the pit of their stomach where they really don't want to respond to that or be on that call. Physical symptoms, headaches, stomach aches, muscle tension, and then increased absenteeism, so missing of shifts or work. They could have presenteeism, which is they're there at the job, but they're not really fully there. And then those thoughts that might creep in of leaving the profession. The next is compassion fatigue. And this is a state of tension and preoccupation with the suffering of those being helped to the degree that it can create what we call secondary traumatic stress. So it's that phase before secondary traumatic stress where we start to feel emotional exhaustion after the shifts or intense cases. And not just that we did a lot of really good work, but really depleted, and that the neurochemicals that we normally get as the benefit of helping others just are not enough to help us recover. We have reduced ability to empathize or feel compassion. We might feel numb, detached, again, cynical towards our clients. They're just not doing the work, they're not using the resources. So, a lot of blaming towards the community we're trying to help and serve. Decreased sense of accomplishment or purpose, heightened irritability or anger toward colleagues or clients or policies, administrators. Again, sleep disturbances, intrusive thoughts, avoidant behaviors. Disruptions in sleep is actually a gateway, and most people will go to the doctor because they're unable to get good sleep. But unpacking that, we oftentimes can find that's where compassion fatigue lives. And then withdrawing from social supports or peers. So, not having capacity to give to others, even things that you might enjoy normally, you don't even have the capacity to engage with those things. And that can include coming home and being with your family. And then the last one is secondary traumatic stress. This is the natural consequent behaviors and emotions that result from knowing about a traumatizing event that was actually experienced by somebody else. And then the stress resulting from helping or wanting to help a traumatized or suffering person. So, some of the signs are intrusive thoughts or nightmares related to the client's trauma, avoidance of people or reminders associated with the traumatic material, hypervigilance or an exaggerated startle response to all kinds of sensory input, like when the phone rings or we hear an alarm or, the sign of the sounds that EMS makes when they're coming. Anxiety, sadness, hopelessness that may be triggered by client stories and disproportionate to what we used to feel. Because remember, trauma connects itself to past experiences. So when we experience a traumatic event or have a secondary traumatic event, those feelings sort of collect and find each other and then become this really big feeling that may be disproportionate to the moment we're in, but makes sense to all the moments that are tied together. We might have difficulty concentrating during or after crisis calls, feel on edge or emotionally flooded after being exposed to trauma narratives, and then again, physical tension, sleep disturbance, or starting to have somatic complaints because stress will find the weakest spot in our bodies, whether it's our lower back, our knees, our heads, our shoulders, our stomachs. So it will find a way out. And if we have any weak points in the body, that's usually where it's going to target. So it's important to know and understand, how do each of these three things impact each other? How does burnout and compassion, fatigue, and secondary traumatic stress all tie together? Before we go into that, I just want to take a few moments and I want you to think of one workplace stressor or experience that you may have had recently. And I want you to think about how it impacted you. How did it impact you physically? Where did you or do you notice it in your body? If you were to think about it, where automatically do you become aware of it in your body? Do you feel it in your stomach as you remember the incident? Do you feel the tension go up in your body? Now remember, you're not in that moment. You're just recalling it. Psychologically, what were the accompanying thoughts or emotions or behaviors that you're experiencing with it? What thoughts are coming up for you about that incident, that stressor? What emotions? What behaviors is it bringing out? What do you want to do? Do you want to shut off this recording? Do you want to fidget, right? Do you want to phone a friend? Do you want to grab a snack? Do you want to get into a different position? Is your body temperature changed? And you want to get a sweater? These can all be reactions. They're very normal and okay because that was a really tough experience. Socially, how did that experience impact your workplace and your personal relationships? Did it? Didn't it? Were you kind of disappointed at the response or the interactions that other people may have had around that? Maybe the supervision you received or didn't receive. Maybe the way you came home and asked for some space and you weren't able to get it. Spiritually, why do you believe that that happened? And what meaning does it have for you? And then culturally, how does it impact your cultural identity? How does your culture impact your management of it? So, as you think about stressors, this is a way to sort of walk through each of them that's a self-care because acknowledging it, sort of like when you validate somebody else and they feel heard and seen, like what you do in your jobs, doing that for yourself, right? Where am I feeling this physically? How am I experiencing it psychologically, socially, spiritually, culturally? And then notice those signs and those patterns. That's the first step in preventing escalation from compassion fatigue to secondary traumatic experiences or burnout. Okay, so let's move on. There was a project called the Compassion Fatigue Awareness Project, And as a result of this, they have some in particular, three free self-tests that you can take to sort of look and see the symptoms of compassion fatigue, life stress, and empathy in your life. So they have this professional quality of life test. It's in version 5 and it's by Beth Hudnall Stam. It's 30 items, a self-report. It's a questionnaire and it assesses both the positive and the negative effects of helping others who are suffering a trauma. It's really important that we also talk about the positive because there are benefits that we can get from doing this work. Just want to keep those columns both balanced. It'll assess for compassion fatigue, burnout, secondary traumatic stress, and this is the important one, compassion satisfaction. And we will talk about that next. So if you click the link above on this slide, you can complete any of those assessments for free. And it's just a way to sort of touch base with yourself. Now, one thing to remember is there is self-report bias. So sometimes people might take these and under-report or over-report based on their current mood or some stigma they may perceive. Timing matters when you take these. So if you had a recent workload change, recent traumatic exposure, lack of sleep, a lot of interpersonal stress that may or may not be influenced by your job, that can influence the score or the outcome. Also, cultural, organizational, and situational factors can influence it, like the deployment length, your resources, peer support, leadership, all of that can affect how that tool reflects your actual risk for compassion fatigue. So, just keeping that in mind when you take these things, it might be good to take it a couple of different times. One, to make sure that's the correct assessment of you, and the other is to see how well you're doing making those self-care changes and if that's changing your risk. So let's talk about compassion satisfaction. Compassion satisfaction is a core but often overlooked concept when we're thinking about crisis response work and helping professions. It represents the positive side of caring work. It's the reward, the fulfillment, that purpose that we feel we're getting from helping others, even in high stress. Not everybody can do what you do. Just like you couldn't imagine doing some of the jobs that others have. What you do is so special, and it is okay to draw satisfaction from that. And that is sort of that counterbalance that we need to be able to tap into as crisis responders. So I want you to take a few moments, feel free to pause the training, and I want you to write down some examples of compassion satisfaction, those rewarding and uplifting parts of the crisis care work that you do. So feel free to pause this for a second and then unpause and rejoin the training. If you paused, welcome back. So some of the compassion, satisfaction things that you may have written down are feeling energized or proud after helping somebody through a crisis or life-saving event. Maybe the work in itself gives you meaning or you feel that sense of making a difference. Maybe you're honoring the memory or the experiences you had with a loved one. Maybe it's that feeling of a sense of teamwork and purpose with your colleagues in the field. Maybe you're drawing from positive outcomes that you've seen from your work, like stabilizing a situation with somebody, reuniting a family, or uniting a family around its hurting member, and then helping somebody to regain hope where they had lost it before. So keep track of that list, put that in a special place, and pull that out when you're having really rough days to remind you of all the good things that go with doing this work. So let's move into the second objective, which is some evidence-based self-care strategies and some resilience building practices that can reduce burnout and compassion fatigue in high stress environments. So what do you like when you're dysregulated? So you're going into the field, you're working with people who are having such a hard time regulating, right? So Their prefrontal cortex, their stress response has gone offline. They are all in their amygdala and hippocampus. They are all in their core emotional self and in their memory space where like experiences have come flooding in and they're overwhelmed. So, some strategies that we can do at the individual level to refill our bucket are some mindfulness-based interventions. Now, it can be many things to many people, right? And so it could be yoga, it can be going to spin class, it could be playing with your animals, going for a walk in the woods, just going outside and touching grass. Maybe it's cooking for your family. It's, shutting down all of those other parts of you and kind of focusing in on one part of you and being mindful about what you're doing. And that has nothing to do with the job that you've just done. So, mindfulness is such an important part of reconnecting that nervous system, getting that prefrontal cortex back online so you can relax and restore. Some other self-care strategies can include really good sleep hygiene practices, having balanced nutrition, just feeling good about what you're putting in your body. Maybe it's setting boundaries, not isolating and being too restrictive, so making sure you're setting up some social interaction opportunities. Maybe it's like moving away from people-pleasing behavior so that you can fill that bucket before you go back to work. So for some of us, it might mean setting more boundaries. And for others, it's self-compassion, that it is okay to take care of yourself, even though your job is all about taking care of others. Sometimes caregivers are the worst. We just do not take care of ourselves, and that is actually the first priority. And then the last is debriefing. The best thing you can do sometimes is just to talk to other people who do similar work and say, hey, do you experience this? It's scary to bring it up, but I'm guaranteeing you, you are not the only one who feels that way. And when we find community in sharing similar feelings and experiences, that can be very regulating and very healing and very validating. Now I want to move into talking about some interpersonal and team level strategies for regulation. So if you have like emotional volatility, so you have a team member or several who are very overreactive to feedback, quick to escalate to arguments, they don't seem to have a lot of emotional control and they're blaming others. What we want to do is reestablish psychological safety. And that comes from modeling at the leadership level. So that's where your supervisors and your leads, they show that vulnerability. They say, gosh, we made this mistake, or this is how I'm feeling doing this work. They show that honest emotional response. So when you model it, other people see that and they realize that's an okay thing to do in the job. And then we normalize feedback. Feedback helps us to grow. Feedback keeps us challenging ourselves so we don't maintain a level of homeostasis that's not healthy. Feedback goes back and forth, and that we establish that no blame culture. Right? So if somebody makes a decision that may not have been the best, like what facilitated that? Is there a training change? Is there a community team building change? Do we need to pay more attention to debrief? So emotional volatility and then just walking across to some regulation ideas. Poor communication can be another dysregulated symptom on a team where you have a lot of people who might be, or several, who are defensive, unclear, avoidant. They might talk over each other. They communicate to survive, so very transactional relationships versus collaborative. So this can be counterbalanced by setting communication norms, having meetings, check-in emails, having real conversations. Something we use is called liberating structures, where you do that structured turn taking. You might have small group conversations with time limits and guided questions, and making sure everybody gets the opportunity to talk and contribute meaningfully. We get to surface those hard truths, train in those communication skills like active listening and giving and receiving feedback. And you can do it with things that are fun, like making a peanut butter and jelly sandwich, Or so it doesn't have to be strict about the crisis work, just about the experience of getting feedback and how it felt. And then role confusion. So that feeling of being overburdened or underutilized, that can lead to resentment or even micromanagement. Some people feel like over managing teams is the solution, but that can also result in role confusion and disengagement. So we want to set clear roles, shared goals, create accountability rituals like weekly check-ins. We also want to make sure our leadership is being coached. Sometimes we don't give enough support to our leaders. So how are we continuing to give them safe spaces to be vulnerable and learn from each other and have transparent decision making? And we want to make sure we're walking the walk, right? If we're going to expect our clients to do it, we need to be able to do that with each other. Another is conflict avoidance. So we might see people aren't talking about conflict, or it goes unresolved. People are just upset with each other and then it goes somewhere, but it doesn't get talked about. So we need to have conflict resolution practices. Like, how are we going to talk through things? Because when we're able to do that, we actually get closer and better. But it's scary kind of getting over that space, and not all of us have the skills to sort of name the elephant in the room and then create that honest space to let the tension rise so that it can come down in a safe way. And that's called emotional intelligence practices. So there's really good skills that can come from that. Low resilience. So this is a dysregulated symptom that can cause people to feel easily overwhelmed and it can derail progress. So we have to rebuild trust and cohesion. Um, Authentic communications, we can have storytelling exercises, sharing personal experiences to humanize, build empathy, and then reminding everybody about those shared values. Burnout and fatigue, again, chronic stress, exhaustion, low morale, absenteeism and presenteeism, cynicism, detachment, and again, you're going to hear me say this a lot, regular debriefs on how the team is working, not just producing. Here's how many people we saw, how many people were sent to the hospital, how many people weren't. This is really just how are you? How are we? How are our relationships? How is our rest? How is our self-care? How is it affecting our decision-making processes? How are our policies working? Using regular check-ins to sort of reset that energy. At the organizational level, and this is important because so much self-care we talk about is at the individual level. And I hope you're hearing me say it is at the individual level and at the team level and at the organizational level. So you're going to see where dysregulation comes in at the organizational level is going to be a lot of staff burnout. And so the solution is some better self-care programs and really looking at workloads. So as you grow in your work, or if you're seeing severity of certain referrals or situations come up, how are you doing those regular check-ins, training, support circles for people so they can be prepared for that work? How are you setting clear boundaries on work hours to ensure that your employees are getting adequate rest? And how are you offering access to mental health resources and resilience training to your staff? Are you offering it enough or is it accessible? Another dysregulated symptom at the organizational level is lack of clear communication. So we need to set up regular team meetings and briefs to share updates and case information. Do we have digital boards, chat systems that we can use that are protected and secured? Can we create clear protocols for sharing information and decisions? So maybe not all through email. Are there other vehicles so we can ensure the message is getting out to everybody? There's ineffective de-escalation procedures, so really looking at simulation trainings for your staff so we can practice some of these procedures to see if they're really effective or need to be changed. Sometimes when new people come in, new ideas come in, or sometimes they're bringing in their procedures from their former jobs and they're not flowing exactly with ours. So making sure that we're reviewing all of that and that we're all speaking the same process is really, really important to keeping your organizations regulated. Inadequate resource or staffing is another one. So we always want to be looking at our staffing needs to make sure that we have enough of talent and people to manage the workload. We want to cross-train our staff so that we have flexibility during crisis periods. If there is a major event where we're getting a lot of volume, how can we cross-train our staff to be able to respond? And then partnering with other agencies so we can share resources during peak demand times. I know in crisis work, oftentimes March can be a really busy month, simply because and depending on where you live in the country, with seasons changing, people think they should be feeling better and they're not. And so call volumes might go up around the holidays or certain times of the year, and we want to be able to plan for that. Dysregulated symptoms like high staff turnover, lack of retention. So if you're starting to see a lot of staff turnover, it's really important that we start looking at what are some of the things that we might be able to do better. Where are our pain points and how can we improve? Do we need recognition and reward systems, more training, more debrief opportunities? Also, career development opportunities. Can people see a path forward where they can elevate to different levels of responsibility or create something that they then have some pride in because they brought their culture or their community ideas or their innovations to the team? And then slower inadequate decision making can be another symptom. So where we escalate things to leadership, but then we never hear anything back. And where are those bottlenecks? And how can we create better feedback loops so we can continue, evaluate, and adjust our processes? We want to make those real-time decisions during crises, and we want to mirror what that can look like at an organizational level. The other is confusion over roles and responsibilities. So, clarifying those roles, reviewing job descriptions regularly, using team building exercises to help understand what each of us does. What's our superpower? How does, what somebody does at the front desk differ what somebody does, at the checkout and some in between, or somebody who goes to a call versus somebody who sits and answers the call and triages. So, we want to be able to have those role clarification meetings to clear up any ambiguity. If we don't have trauma-informed practices, how do we provide that training, that mandatory training, so people know what does that mean to be trauma-informed? Is it an act? Is it a word? Is it a feeling? And it's everything. We want to foster that environment that prioritizes emotional safety for our clients and then regularly evaluate the well-being. Probably needing to reevaluate well-being more often than we would in other workplace environments. And sometimes limited collaboration with community partners can be a symptom of dysregulation. So, how do we have ongoing meetings with our community partners where we talk about some of the issues that are causing people to continue to come back through the crisis system? Are we effectively meeting the needs of those with intellectual and developmental disabilities, people who are experiencing housing crises, food and securities? So, how do we form these partnerships to help the people that we're serving to move out of their crisis pattern? And then doing joint trainings can be a great way to build those partnerships and sharing those resources. So let's do a quick self-care audit. I just teased you a minute ago and showed you the slide and then pulled back, but here we are again. I want you to just take a few minutes and you can pause the training and read through each of these check boxes. I'm going to read through them just in case you're in an environment where you can't see the screen, but I want you to really sit and think about. One, are you getting 7 to 8 hours of sleep regularly? Or are you finding yourself binge sleeping when you're off of work? So if you've got like a long weekend or several days off, are you spending most of that time sleeping instead of doing, and you may think that's self-care, but we want to see people get a regular amount of sleep if they can to really effectively do the job that you're doing because it is very hard. Are you setting micro boundaries between calls or cases, even just 2 minutes of deep breathing? Are you debriefing with your supervisor or a colleague after difficult cases? Are you engaging in at least one enjoyable, non-helping activity weekly? Means something just for you. At least one thing. If you're going to one spin class or one, walking through the store on your own with no time expectations, walking through the park, taking a hike, watching birds, whatever it is, one enjoyable thing that's not about helping somebody else. Having a healthy, nutritious routine, avoiding crisis dieting or going between caffeine and skipping meals. Talking to the person who might be struggling directly and working to resolve the tension. So, are you creating space and time in your personal or professional lives to actively engage and talk to people about the tension so that it can be reduced? Are you scheduling regular recovery times? So, intentionally disengaging from work, not checking emails, text messages after hours. Are you connecting socially with supportive peers or loved ones? When's the last time you called your best friend or the person closest to you just to talk? And then revisiting the why. Remind yourself, why did you move into this work? When's the last time you really sat with it? Your personal mission. Why did you move into this space and reconnecting with that? And then after you go through this self-care audit, I want you to pick one area that you want to improve on in this next week as a commitment to yourself. Just one of those check boxes. Maybe it's just calling somebody you haven't talked to in a little while, or listening to some music that you haven't had a chance to hear. All right. So the last objective, objective 3, is developing a personalized, sustainable self-care plan to help you promote that long-term well-being and effectiveness in your work. So some of that self-care audit, we're going to now use into an action plan. So why does personalized self-care plans matter? It's because generic strategies will fade. If you try to come up with something that works for everybody, it's not. Everybody's different. Our nervous systems are different. Our support systems are different. The way we balance work and life demands is different. So our strategies for self-care have to be different. So these individualized approaches that are going to tap into care for our physical well-being, our psychological, emotional well-being, social and spiritual, and cultural well-being, all of those are going to be very unique. So let's just spend a little time there. So the core components of a self-care plan are paying attention to the warning signs, so those personal red flags that you might have for stress. So how do you know you're stressed, right? Are you more irritable? Do you have headaches? Do you have dermatological changes, appetite changes? What are those warning signs that you know you're probably not getting enough of self-care? What are those preventative practices that you're trying to do, those daily or weekly habits? Maybe they've fallen off a little bit, but let's get them back on, like exercise or meditation, journaling, gardening. Um, the crisis coping tools. What are those immediate strategies that you use when you're overwhelmed? Like diaphragmatic breathing. So breathing it in and holding for 4 seconds through your nose, and then breathing it out, maybe for 8 if you can, and then holding. And going cycles of that breathing so that your nervous system, your respiratory system, right, your heart rate can all realize you're not in danger. You will feel better. Breathing is such a powerful tool. Or maybe it's calling a peer, somebody who understands the nature of the work that you're doing and can just walk you through some regulation strategies and just listening. Your support network, having those trusted colleagues, supervisors, and mentors. So hard for our families to understand what we do unless they do it as well. So we need those people that we can call who do understand the nature of the work. And then organizational advocacy. How do you use supervision to have workload changes if you need to make those adjustments? And then really speaking to team care, like, hey, we're all really suffering right now. Um, and so we can do some things differently to keep everybody well. Some trauma-informed principles that you can apply to your self-care, and these are just four, but we want to pay attention to safety. And remember, safety is not just physical, it's psychological safety. Do I feel safe opening up and sharing, what I'm feeling? Or how do I ask somebody else in a safe way? Trustworthiness and transparency, making sure there's that opportunity for open communication between supervisors and team members with each other, right? Empowerment and choice. So making sure it's not just everybody, needs to do this. Everybody needs to journal. Everybody needs to, you know, take today and do this specific thing, but just giving people, what do you need? What's going to help you to regulate and to refresh and renew? And then that culture humility piece, which is acknowledging the personal and cultural differences that we all might do things differently. We might cope differently. Resilience might look differently. The language we use to describe those might be different. And that we honor that. And we always come from that position of learning, both with our clients, having them teach us how they regulate, what helps them, as well as each other. So, creating your own self-care plan is about finding what works for you. What are those things that you feel like you need to do a little bit differently so that you can feel more connected to your core self, so you can get refreshed. So, when you go back in for a shift, you feel like you're bringing your best self to the work. And if you're unable to do that, how do we make those adjustments? And that all begins with that self-care plan. And remember that plan can be at the individual as well as your supervision team and organizational levels. Right now, we're just going to focus on you. So, crisis response workers who proactively structure self-care are less likely to experience severe burnout and can regain control in high stress roles. So this is why we do this, is right now we may not need it as much, but setting it up will prevent things down the road. I tell, the people I train all the time, self-care is probably one of the most important things we will do in our jobs, as well as ethics and then good technique, right? So all of those are critically important partners to a long and fulfilling career. These domains that we want to include in our self-care plan, we want to have that physical domain. So what am I going to do to take care of my physical being? The emotional domain, how am I going to take care of my emotional self? That cognitive professional, what do I need to continue to feel challenged, reflective? I want to continue to learn. I want to set healthy boundaries and I want to continue moving forward in my work. What are those relational, social parts of my self-care plan that I need to hold myself accountable to continuing to connect with my support system and my peers? Those spiritual meaning-based questions that we had earlier. What do I need to connect with that part of me? Do I need to do meditation? Is it prayer? Is it different mindfulness things? Is it time with nature? Is it just re-examining my core values? And then those emergency coping tools. When I'm feeling dysregulated, what are some things I can do to remind myself that I'm safe? Is it a visual imagery? Is it a breathing activity? Is it a movement that I need to do with my body? How do I ground myself? And that should all be part of that plan. So I've created just a little self-care map for you as you wind down the training today. I'd like for you to pause, and if you were to draw this wheel out, what would you put in the physical? How do you want to take a little bit better care of yourself? Physical, spiritual, emergency coping, relational, and social and cognitive. So, if you could just take a moment and create that self-care map, think of the ways that you can improve your self-care plan. Because you know, as well as I know, if we don't do it right now, we're not going to do it. And then I want you to share it with somebody. So if it stays with you, we're less likely to maybe move forward, but find somebody you're willing to share it with that can help be an accountability partner for you to make those changes. Like, how's it going making that change? And do it for them as well. If you paused, welcome back. So, in sum, I just want to pull it all together for you. Crisis work is high stakes. It is emotionally charged. It is unpredictable. That is the nature of the work. That can be what excites us as well as challenges us. So, just validating that this is a part of the job. And you have unique stressors in the work that you're doing that are extraordinarily real, and I'm validating. Burnout is a workplace driven situation, not a personal failure. So when burnout's happening, there are some organizational things that are happening. So that's why that self-care we talked about has to happen at all three levels. Compassion fatigue develops gradually. So if we can do self-care, we can eventually get to the point where we can prevent that compassion fatigue from setting up real estate or walk back from it. Secondary traumatic stress can mirror trauma symptoms, so it is very serious. It can have an effect on your overall health. So we take that very seriously, and we want to definitely take care of that. Whether it's getting your own therapy, whether it's just talking, having debriefs regularly. Compassion satisfaction is a protective factor. Talk about what you like about the work, the rewarding aspects, the validating elements, the reasons why you would do it over and over and over again, even though it's hard. And that self-care isn't just fluff, it is a professional responsibility that we all need to take very seriously. And I'm so grateful for Mississippi for recognizing that and how it should be a critical component of this training series. So thank you for completing this module. The library that we have for all the training contents is going to continue to be developed. We started in May 2025. We'll continue to compile these trainings, and they're getting up on the Department of Mental Health's website very quickly. So check that website that's linked to this slide frequently for updates and new training uploads. And here's some examples of some training library topics that we have had. So you can see there's like a wide variety of trainings, many more that you can visit. And we just really appreciate your taking advantage of that. Follow us on social media, so Facebook, YouTube, Instagram, lots of places where these trainings are being advertised as well as healthy practices and ideas are being shared. So stay connected. That'll help us all be connected across the state. And I hope you have a wonderful day. Thank you.